Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Sammie Mosier, who is the Senior Vice President and Chief Nurse Executive at HCA Healthcare, about the health system's new CNC resource tool. So, hi, Sammie, how are you?
I'm great. How are you?
I'm doing well. Thank you for taking the time to join me today for this. I'm super excited to talk about this story. So right at the top, what was the inspiration behind the CNC resource tool and what sort of pain points is it trying to address?
Yeah, let me start off with a little background. We have a position on our teams that is called the clinical nurse coordinator.
Hmm.
So that is sometimes equivalent to a charge nurse on the nursing units, but we call ours clinical nurse coordinators, and
Hmm.
they're the leaders on the units 24/7. 365 days a week. They're the ones that are closest at the bedside leading our team. So
Hmm.
they're just a very important leader for us. And so, HCA is a very large company. So, to continue to gather the voice of our leaders, we leverage our structure to do that. So, we're divided up into three groups, and then those groups are divided into, 14 divisions. And then under those divisions are multiple hospitals.
Hmm.
So, to ensure that we have good representation across the company, we identify leaders from each one of our divisions to serve on our shared governance councils. So, for
Okay,
this
cool.
one, it's called the CNC Council. And so, those individuals represent their teams both at the
Hmm.
hospital and the division level. So, we invited our CNCs to Nashville to talk about some of our strategies. We've got a nursing strategy, and part of that is advocacy and leadership. So,
Hmm.
ensuring that we're investing in them and giving them the tools and resources to do their job. Well, during one of our sessions, as we were talking about technology, our CNCs that were in that cohort came together and they said, we would really like more information at the unit level that we have real time on our phones to be able to make decisions while we're on our shift.
Hmm.
So, we started talking about that, and then we pulled in our ITG partners. That's an internal team at HCA, as well as we have a nursing infrastructure, so a corporate nursing team that helps work on anything that our teams at the field decide that are important to us or important to them. And we started talking about that. And we started talking about what this could look like.
Hmm.
We have some tools that are in use within our hospitals now. So one is called the NATE tool, which is a real-time view of data within our hospitals. So we leveraged this tool during COVID, and during COVID, we were able to understand where our patients were living in the hospital, what their condition was, and our nurses really leveraged that tool as well. So they challenged our IT team to create something that they could leverage.
Hmm.
And so, based on that, we started coming together and started plotting out what this could look like and what core metrics, both metrics that were operationally focused at the unit level, but also what metrics we want to think about for our nurses that they could judge the healthiness of both the unit and that individual nurse that was working.
Hmm.
The goal in mind was for our charge nurses to proactively use the tool, and then based on the results they could go and assist a nurse if they were falling behind, or ensure that everyone had lunch. That's very important to our
Hmm.
teams for well-being.
Yeah.
So the charge nurses outlined what the metrics were. We worked with our IT teams to see, can we pull it from our EHR? Do we need to pull it from our payroll systems? Where do we need to leverage that information together? And they pulled together and brought the tool and the framework back to our staff, and continued to work in the direction to make sure that it was a valuable tool for our charge nurses or our CNCs.
Mhm. Absolutely. I love that it was a multi-pronged team effort and that the nurses were really at the front line of creation because that's super important.
Absolutely.
Um, yeah, so talk to me a little bit about what the tool actually does. What would be the average experience using it for a
Yeah.
charge nurse?
Sure. So our CNCs would pull up the tool on their phone. So it had to be an app and it had to
Mhm,
be real time data. But they'll pull up the tool and they'll go directly into looking at the performance of their unit. So, how many patients are coming in, how many patients are being discharged, what's the lunch schedule for our team. So, different variables.
mhm,
And then there's some flags on that. So they see the care team, but maybe there's a flag that helps them understand I need to check on this nurse. And
mhm,
so if they go into the individual nurse, they can go through the patients that that nurse is caring for and understand if there's anything that they need to proactively help that nurse with. So
mhm,
they could see if anything's missing from a task, or maybe that nurse hasn't gotten lunch and so they need to work with them to do that. So different variables based on the unit. So we have scaled across the enterprise in med surge. We're
mhm.
working on our behavioral health population. So whatever those clinical components are, our teams are working to identify the highest importance so that they can operationalize that.
Mhm. Absolutely, and you mentioned some of the metrics, that the tool tracks, so what are some of those?
Yeah. It measures medications if they
Mhm,
have been completed. It measures tasks. So if there was an order that the nurse needs to complete based on the physician's guidance, it measures our frequency for vital signs.
mhm,
If the patient is having any challenges with vital signs, it will flag that. So
mhm,
that charge nurse gets insight to that early. Um, and then so that's more of the patient metrics, and then just continues to measure the healthiness of the unit. So what does our throughput look like? That's really
mhm,
important to us. Ensuring that if a patient has a discharge order, we're helping that nurse discharge that patient appropriately. So
mhm.
different variables that they identified were important.
Absolutely. So what has been the impact of this tool on the nursing workforce so far?
Yeah, it has helped. Probably with our new grads more than even our experienced nurses. So
Mhm,
that CNC can pull that up. And, as a new nurse, you're just finding your way and your
mhm,
schedule and prioritizing things. So it has allowed that charge nurse to proactively go and assist that nurse, maybe help them prioritize some of their tasks, because that's, just part of being a nurse and being able to manage your day. So that has really helped us with engagement and retention.
mhm,
Additionally, we have different positions or roles within the company that are leveraging the tool as well.
mhm,
So we have a position called our clinical support nurse, and that individual just rounds on our new grads to make sure that everything's going okay. We've got a residency program, but after completion of that, for 2 years, we monitor our nurses just to make sure that everything's going okay. Well, now
mhm.
they leverage the tool because
Oh,
they
that's
see
good.
the value, and it helps them determine where they should prioritize their day. Who should they
Mhm,
reach out to first? So a lot of proactiveness. I'm using that word a lot, but when we're able to really use that real time data to inform decision making, it really does help with efficiencies and ensuring that we're prioritizing things in the right way.
absolutely. Yeah, getting all the bases covered, for sure. So do you anticipate adding any additional features to the tool to improve upon it in the future?
Yeah, we definitely have a great foundation, but back to that CNC Shared Governance Committee,
Mhm,
they have other asks, as nurses
mhm.
always do.
Yeah.
So they are continuing to outline different features that they would like to see. The priority, though, that came in was to expand beyond the med surge, medical surgical specialty unit. Um, into more of the L&D areas, so women's health, expand the tool into behavioral health. I was telling the team before you got on that I
Mhm.
actually had one of our CNCs that lives in one of our hospitals, and she emailed me. She works behavioral health, and
Mhm.
she was like, "When do we get the tool?" And
Oh,
so
yeah.
that's always positive, right? Is when it is more of a pull versus a push
Yeah.
type of situation that you know it's valuable and it's intuitive.
Mhm.
I was happy to say that based on our charge of nurses or CNCs prioritizing, they're going to start getting the tool in August. So it'll start
Oh.
rolling out across our company. That's been some of the priority, as well as our, our patient care techs,
Mhm.
ensuring that they're as included in the tool as well. That's been a priority for our nurses. So really looking at that care team and expanding it beyond just the nurses' workload, because that's where the magic happens, is
Mhm.
leveraging the full team to care for the patient.
Absolutely, yeah, and it's like you were saying, it's great when other people are, like, asking for it,
Yeah.
instead of you having to say, like, "I promise this will work for you." It's always better that way. So my last question for you is, do you have any advice for other CNOs or CNEs who might be interested in implementing something similar?
I think it always goes back to understanding what's important to the nurses,
Mhm.
leveraging their voice, listening to their needs, allowing them to brainstorm can be very
Mhm.
powerful. And then being able to give them small wins. We started small, but we've got a great tool now.
Mhm.
But being able to prioritize what they're after, that's meaningful and that's value add. So I never want to bring a product forward that doesn't include their insight and their voice. So I
Mhm.
would encourage other CNOs to do the same. Get your reality check. HCA is a really big company, but we want to focus on what's right for our staff.
Absolutely. Well, thank you so much, Sammy, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights. And thank you so much to our audience for listening. Thank you, Sammy.
Thank you.